My name is Dr. Heidi and I'm a naturopathic doctor, and today I wanted to talk to you guys a little bit about the most common reason that people see a doctor today: pain. So pain comes in all shapes and sizes and all reasons, but first let me kind of tell you a little bit about me, give you a little bit of background from where I came from and how I practice. So as a naturopathic doctor, I took 4 years of an undergrad, went into 4 years of medical school, and a similar education to that of a medical doctor for the first 2 years. And then the second 2 years, we really focus on the naturopathic principles. So, and learning all those modalities: homeopathy, hydrotherapy, plant medicine, Chinese medicine, and all of the modalities that live under the umbrella of naturopathic medicine. So if you've tuned in to previous talks, you kind of know that because I've talked about it a lot. If you haven't, definitely check out the links to my past videos. So those are both on the Facebook page as well as this Zoom link that you're watching on. So go ahead and check those out. Naturopathic medicine, big umbrella term. In my eyes, it's everything that's natural, everything that our natural world has to offer, including physical medicine, chemical medicine, as well as energetic medicine. So what are those things? That's kind of how I see the body is in this triangle. So we have our physical, that's our structure. That's, our bones, our joints, our muscles, but also like our internal organs, our viscera is what it's called. And then we have our chemical body, which is more of different chemicals and nutrition and supplements, food that you're eating, all of those kind of things. Oh, it looks like I lost my internet connection here. Shucks. Hopefully my Zoom will come back on. Sorry about that for all of you watching on Facebook. So so we have the chemical side of things, food that you put into your body, supplements that you take, that kind of nutrition, the nutrition that you're eating. And then as well as our energetic body. And so our energetic body consists of, emotions, energy, spirituality, everything that exists in that etherical world, acupuncture points, acupuncture meridians, things like that. So today we're going to talk about pain, and so pain is going to be at the forefront of what we discussed today. And so there can be different types of pain as well. So there can be that physical pain, and so that looks like, I like to use the example of you sprain your ankle. And so when you sprain your ankle, yes, it's inflammation, it's acute, right? So that's the acute pain versus, here we are. Hey, Melissa, oh, here we go. Hey there, sorry about that. Hopefully you can hear me and see me now. I'm glad you didn't sign off. So I talked a little bit about, what a naturopathic doctor is, what we do as natural medicine, my little pyramid or triangle that I always use. So we have the chemical side, the structural side, and the energetic side. And so I'll, dive into those as we kind of cover this pain pathway. So, okay, let's talk about an injury. So you sprain your ankle, right? So there's a lot of muscles that are pulled. There's bones that could break. There's inflammation that's going to come up. Inflammation is an interesting thing. So inflammation is just the body's response to an injury. And so the injury can happen like that sprained ankle. The injury can happen like somebody talking to you and like saying something bad about you, right? Like that hurts too. And so it could also be an injury from food that you're eating. If you're eating something that's not registering well with your body, we can get inflammation from that too. And that's, again, that inflammation, chemically, kind of internally. And so if we have that inflammation, we have cytokines. So cytokines became a little popular this year with the cytokine storm that we've kind of talked about with COVID. And so not sure how much people know about that cytokine storm, but what it is it's messengers. So we have all these little messengers that are talking to each other, and when we get inflammation or when we get an injury, those messengers are talking now to that tissue, and it's trying to say, hey, we need to heal up this tissue. So white blood cells come in, red blood cells come in. We get the general, inflammation pathway. So it gets red, it gets hot. Why is that? The blood cells are dilating, so we're getting more blood flow, more circulation in. You get, that redness, that heat, that pain, the stiffness, right? Because it's like, what was the analogy I was thinking? So if you were to, if it snows overnight, here we are up in Conifer, right? So if it snows overnight, and you try to go out and shovel and it's just ice, it's hard to shovel at. Versus if you let it melt and then you shovel that afternoon snow, it's a lot easier. So those are two different types of inflammation as well. We have inflammation that where in the morning you feel just like sore and stiff and it's hard to get out of bed, versus that inflammation, that pain that you get in the nighttime, after overuse, like you've been using the joint a lot and you have an overuse injury. So that's considered osteoarthritis. Versus the other one is sometimes, that rheumatoid arthritis, that more inflammatory arthritis, where you get more of that pain in the morning time. This is a big distinction that I use with my patients. I'm always asking, when is your pain? Are you stiff in the morning? Are you worse in the morning? Or is it more, worse at night? Okay, so then we have chronic pain. So sometimes this occurs, we, sprain that ankle, we wait our 6 weeks. It's usually a 6-week healing period, depending on what kind of intervention that you get. And then it still is just not going away. So the muscles have healed, the ligaments has healed, but there's something going on in the nervous system saying that like, hey, I still have an issue with this ankle and we need to kind of, do something else, some other type of intervention in order for that ankle injury to heal. And so I have different techniques that I use in my practice. So quantum neurology is one of those. And what quantum neurology is it's a neurological test. So we're testing the nervous system to see, okay, even though this ankle feels stable, is it actually? And so with the muscle testing, we can very quickly, diagnose like, okay, what nerve level is this happening on? For the ankle, again, it's mostly that S1, L5, L4, L3, somewhere along that line. So we're testing the nerve in order to diagnose that ankle. And then we do a treatment with quantum neurology using light therapy. And so light therapy, like I've talked about in previous classes, we have this energetic body to us, right? And we really respond well to vibrations and frequencies. And so the light therapy that I use is at a frequency that creates cellular rebuilding and healing. And so, using the light therapy on that nerve that's damaged because of that injury that is either, 3 weeks old, 6 weeks old, or maybe even decades old, we can still heal injuries from long-term events like that. Okay, so that could be some kind of structural pain, right? Come in, you hurt yourself, we have that structural pain. Well, what about like visceral pain? So like I said, the viscera is those internal organs. So like heartburn or, stomach aches, those kind of things. So what's happening with that? So those sometimes they can be physical pain, like, a scar, like having a C-section, having a scar from that C-section and having that visceral pain from the C-section versus having like stomach ache pain, like you ate something that didn't work well with you. So I consider this a sensitivity. Some people would call it like a food allergy. The way that I test for, different foods, I consider it more of a sensitivity. Like you may not be allergic to it. You may not eat that peanut and have that anaphylactic where your throat is closing up, right? But you do eat that, peanut or whatever it happens to be, and you just get this upset. So it's not really like an allergy per se. It's just a sensitivity. But either way, your stomach's not responding to it. So in the body, neurologically, again, this is all nervous system based, we have different types of receptors. So we have proprioception receptors. So this is like, where is our body in space? We have pressure receptors. We have temperature receptors. And then we have pain receptors. We don't have acid receptors. We don't have bacterial receptors. We don't have, oh, that food didn't respond well to me receptors, right? We just have pain. And so the pain is going to come up, and now it's up to the doctor that you go see, or your own body, depending on how you heal yourself, it's up to them in order to figure out, okay, what is going on? Why do I have that pain? So what I see in my practice, we do a lot of muscle testing. And so what muscle testing is it's that neurologic connection. Is your brain talking to your muscle? Is your muscle talking back to your brain? And so it's a conversation that it's having. And if you're having, a sensitivity, we can test that through the muscle testing and see, what exactly is the sensitivity causing in your body, and then how do we fix it, right? Because that's what we really care about, is how to fix it. So I've seen inflammation come about not only in the gut from eating something wrong, but if you eat something wrong, those red blood cells or those white blood cells are going to come in. That cytokine is going to go out. It's going to communicate with the rest of the body. That inflammation is going to increase, right? So we get that pain, that redness, the dilation of the blood vessels. And so not only is it localized into the gut tissue, but it's going to go all throughout the body. So there's, arthritis and things like that. Well, people diagnose as arthritis, but what it really is pain in the joint because you're eating things that don't work well with you. Gluten is a common one that we hear about these days. People either having celiac, gluten allergy, or just, this gluten sensitivity, because what gluten is doing is it looks a lot like certain body parts. So thyroid, for instance, thyroid can, gluten can cause a thyroid problem because it looks a lot like the thyroid tissue, and so the body is going to attack the gluten, thinking it's and in turn attack the thyroid because they look so similar. Molecular mimicry is what it's called, and so eating those foods can affect your issues as well. Now, the other thing about pain in your joints is that it can come from bacteria. So septic arthritis is what it's called. So if you have pain in a joint, just not sure why, never really injured that joint, but it came across around the time that you had a UTI or some kind of other infection, and we clear up the infection, we see that joint clears up too. So it's not necessarily just that you're having, this localized pain. Like, this pain can be coming from all different things going on in the body. I also alluded to the idea of the emotional body causing pain, the energetic body, like when someone really puts you down or hurts your feelings, that hurts, right? It like physically hurts you. So not only that, but we have these meridian systems throughout our body. So in Chinese medicine, they study the body in different systems. So we have, the large intestine, the small intestine, the stomach, spleen, all of these different systems, and they all connect to different body parts. And they're like, it's almost like following the nerve roots, but it's different places throughout the body. So each meridian system, not only is it located within the body and has these different organs, but it also has different emotions. And so if you, for instance, let's take an example through this. So if you're having somebody say something negative about you, and it really hurts you and it puts you down, you could feel grief, right? Grief lives in our lungs, in our lung field, right? You could also feel angry, like, why would that person say that about me? And so that's gonna live in your liver, because anger hides in the liver. And so instead of, crying, because we're upset, right? Instead of crying about that person hurting you, what do? We tend to just like throw it away and like push it down and just say like, oh no, it's okay, I'm not gonna think about this. And then time goes on, and then you start getting this weird cough, right? And again, I'm exaggerating this a little bit, but that grief lives in your lungs. And so if you don't express it and do something about it, you're gonna have that physical pain based off of what somebody says. So, that was a kind of an easy example. But what about when we're talking about tragedy? A big tragedy like we had like 9/11. And all of these people died, and there was a lot of grieving going on in our country, and a lot of us, or a lot of the first responders in New York, like, they don't have time to grieve, right? You have to go out and do your job, and then you go back, and the next tragedy happens, and so you're just moving from side to side. Well, eventually, like, this wears on people, and we start to feel that emotion inside of our body. Anger is a really, really strong one, because how do we cover up anger? A lot of times it's with drinking alcohol. And so the anger is upsetting the liver, the alcohol is going in and upsetting the liver, and then we get pain in our ankle. What? Well, that is where that meridian is running through. So, that meridian system really plays into where we're going to feel pain, and then how we're going to, how we're going to get rid of it. So that's where I think the fun comes in, is that figuring out not only where did this pain come from, but asking the body the question of, what do you need to get rid of this? So if I have somebody that comes in, with this ankle sprain or some kind of injury, the first question that I ask the body is, what injury is this? Is this a physical, structural? Is this a chemical? Or is this an emotional? And then so we can ask that question and then go down that rabbit hole. And if it's an emotional, we do something called NeuroEmotional Technique, NET, where we can access what emotion it is, what time in your life was it, who was that around, was it other people, was it you, was it around love, was it around money, what was causing you that negative emotion, and then why did it get stuck? And so there's several different treatments that we can do for that. One I'm going to give you guys as a freebie today. It's called Emotional Freedom Technique. And so this is a technique that has to do with tapping on the different meridians or different points on the meridian, usually the beginning or the ending point, and then thinking about that negative emotion that you had, and the body will clear it out. So one of my favorite sayings is that you can't fix the mind with the mind. So if we're, mad or angry or something like that, and we're just like in our mind, like, oh, this person really hurt me, I'm really upset with them, and you just think about it all the time, and you go through life, and it's just like, in there, like that is you pushing it down, right? That's not you getting that emotion into the body. So one of the things I always tell people is, like, if you're angry, go to a kickboxing class, right? Like, punch something, not somebody, but something, like actually physically get it out, or do some jumping jacks, or run in place, or go for a jog, or go for a hike, or like do something physical to like move that energy through you. If it has to do with a specific person, have a conversation, instead of just saying like, man, you really made me angry. Or, instead of just thinking that, like, oh, you made me angry in this person, and now you're just belittling this person in your brain. Maybe you're gossiping about this person to somebody else, but you're not actually addressing them. Like, that's not fixing what's going on. So I'm always telling my patients, like, make sure you talk with the person that's making you angry. Make sure that you can actually get that anger out of your body so that it leaves. Well, that's what the emotional freedom technique does as well, or tapping. So it's actually physically putting that emotion into your body, and then through these acupuncture points, it's able to get released. So I'll have to do a video strictly on the emotional freedom technique, because it is a very, very powerful one. In the meantime, if you guys are, here we are online, right? If you guys want to, throw it into YouTube, it's amazing. Like, you'll see great case studies of people getting better. It helps that emotion, that emotional pain, but it's helping that physical pain. The first time I ever did emotional freedom technique, I was actually trying to treat some stomach pain. And so, nothing emotional that I thought was about it. And I was just saying, why do I have this stomach pain? Tapping through, the causes of it. And sure enough, after my session, it was, it was gone. So, that's one of the great ways to treat the emotions. But like I said, I like to do the NET a little more specific. It works a little bit better, but it's more of an in-office or one-on-one kind of technique. Okay, chemical pain. So let's talk about bacteria, viruses, those kind of things, or even so I call those invaders, right? They're coming into the body, and the body is trying to do something about it. One of the things I wanted to talk about today was a little thing that we call side effects. So again, I was talking about thyroid, so let's use thyroid medicine. So we have low thyroid, we get that lab test, the doctor says, oh, you need to get put on thyroid medicine. You start taking the thyroid medicine, now all of a sudden your heart is palpitating, right? You have really fast heartbeat, your hands are sweating, all this stuff is happening. You go back to your doctor, and they're like, oh yeah, that's a common side effect. Well, it's not actually a side effect, it's an effect. Like, that is the effect of thyroid medication, is that it increases your metabolism. It makes your heart beat faster, right? It puts you into that fight or flight, which makes, your mouth dry, your eyes dilate, your hands start to sweat, and your body get ready to run from that bear, right? So that's the effect of thyroid. It is saying like, yeah, you're taking a little bit too much of it. You don't need that much. But to say that it's a side effect, is not doing it justice, because it's not. It's just the effect that it has. Same thing when we get a cold or the flu or this famous virus that's going on, right? What's the first thing that's going to happen? We're going to get a fever. We're going to get a high fever, and it's going to start boiling up this virus inside of us. Again, not a side effect. That is the effect that the body is taking in order to burn this thing up. So viruses, bacteria, parasites, all of these things live at a very constant, consistent temperature. And as soon as we increase that temperature, we have a better chance of killing the virus. So that's why our body gets a fever. Then we get the runny nose, right? Again, most of the time a cold infection is going to live in our upper respiratory tract. So if we can get that runny nose, we have more of a likelihood to get it out. Same thing with the cough. If it's in our lungs, we want to cough and get it out of the body. So it's not a side effect of having a cold, it's the effect that the body is doing. It's not the virus that's causing the fever. It's not the virus that's causing the runny nose. It's your body that's causing that fever and runny nose to get rid of the virus. So it's actually a healthy thing. So when we get fevers, we don't want to suppress them. When we get runny noses, we don't want to take Mucinex to get rid of it. We actually want it to run its course so the body can actually get rid of, what it's trying to do. Same thing when we have, when we eat something and get that stomach pain, right? It's the body trying to tell us like, hey, stop eating this, right? Like this is hurting me in some way. I'm getting this inflammation from it. For us, very busy, fast-paced Americans, it's hard for us to realize that the food we ate at lunch is causing a stomach ache at dinner. And so, trying to deduce that, and I'm asking my patients this all the time, like, okay, so you got bloating around 2 o'clock, what's that about? Like, what'd you eat for breakfast? Oh, I don't think it was anything I ate. As soon as I put that bug into their ear, and this is why I'm telling it to you guys here, because start thinking about that and start putting those things together of like, you're right, I'm not bloated in the morning, right? I don't have stomach pain in the morning, and I usually only have it in the afternoon after I've eaten something. And so then we can go down the route and say, okay, what are you eating? Without muscle testing, we would do something called an elimination diet, where you would pull everything out of your diet, eat a very minimum thing, see if that inflammation, that bloating, that stomach pain gets better, and then one by one add them back in. Anybody want to do that? Usually not. So with the muscle testing, we can be a little bit more specific. We can muscle test and say, does your body like X, Y, and Z? Does it like, dairy, gluten, nightshades is a really common allergen, and then do the muscle testing, and then I can be very specific and say, you need to avoid these foods, and you'll get better. Now, of course, in the office, we have ways of treating that sensitivity, so it's not just like you're avoiding your favorite foods for the rest of your life. We can actually treat it so that the body doesn't respond as if it's an invader anymore. And it more responds, just like it's food. Now, I have to step back for a second and tell you guys a little caveat. So one of the things, like I mentioned before, that I find on a lot of people is gluten, right? A gluten sensitivity. And so, we'll do I'll tell them that we found this gluten sensitivity. They usually say, yeah, I know, whenever I eat pizza, like I have this issue. And then we'll treat that, right? We treat it in the office, and the gluten sensitivity is theoretically gone. Like your body is no longer inflaming itself because of it. Now, that doesn't mean that it's a health food, right? So I don't want to tell people, oh yeah, you can eat as much gluten as you want now and not feel any side effects. Like, no, sorry, that's not how it works, right? You still want to avoid gluten just for the other, reasons that gluten can be a problem. So, yeah, I've kind of, chased my tail in that sense a little bit, as in like, telling people that gluten's okay, and then all of a sudden it's like, wait, you can't like have bagels and bread and donuts and all this stuff, right? That's just not healthy. But either way, we can make it so that pain, that immediate pain goes away. Let's see what else. So yeah, we talked about the physical, the structural. With that, I wanted to mention a little bit of how I do adjusting. So I'm not a chiropractor, I'm a naturopathic doctor, but I was trained by chiropractors through applied kinesiology. And so, and also in naturopathic school, we learn naturopathic manipulation, which is, adjusting, but really, we call it manipulation. The way that I manipulate is a very gentle manipulation. So it's a respiratory. So what I'm gonna do is muscle test, find where on your spine, where in your viscera, your extremities, wherever it is, your skull, there's a lot of adjusting that goes on here. Find where it is that your body needs to be adjusted, and then very gently with your breath, I move that bone. So next time I'll bring in my skeleton so I can show this a little bit better. But I'm taking my hand and just very gently moving the bone into the direction that it needs to go with your breath. So there's no snap, crackle, popping like you typically see with a chiropractor. It's all just very gentle movement. And so what that's gonna do, if we have that structural problem, let's say it's in your neck and you just have neck pain all of the time, and your nervous system is shouting, hey, help me, my neck hurts, my neck hurts. Nothing else is gonna get healed, right? Because the nervous system is all going to this neck. I use the idea of we have 100 units of energy, arbitrary units of energy, but if we have 100 units of energy at any given moment of any given day, we want to make sure that that energy is used for things like digesting our food, like getting us up in the morning, concentrating to study or do our paperwork or do our job, right? We don't want all that energy going to our neck that's just, screaming at us. But how many people, out there have pain and you're exhausted by the end of the day because you've put so much energy into that pain. And so we can very quickly diagnose that with the muscle testing, figure out exactly where the bone is out of alignment, and then very gently put that into alignment. And again, the nervous system just takes an exhale. It just really takes a sigh of relief, knowing that everything is in alignment and that there's nothing, just screaming at us like, hey, we need to change something. So along with the skull and the extremities and the spine, we can also do that with the internal organs. Heartburn, right? Heartburn could be a structural or a chemical pain. It could be that you're eating a lot of spicy food, or some dairy causes it. Tomatoes, citrus, those kind of things cause it. It could be the chemical side. It could actually be that you have what's called a hiatal hernia. So we have our esophagus that goes down into the stomach, and there's a little hole at the end of the esophagus. It's called a sphincter. So it opens and it closes. And sometimes the stomach goes up into the esophagus, in through that sphincter. And we actually have to go through and manually pull that stomach down. And so in that process, again, very gentle with your breath, really pulling that stomach down to get that heartburn to go away. And as you can imagine, if the stomach is up in your esophagus, your throat, all that acid is coming out. Now I have to talk about the, heartburn a little bit more since I'm mentioning it, but one of the conventional treatments for heartburn is a PPI, which is a proton pump inhibitor. Protons are hydrogen, hydrogen is acid, so what they're doing is they're inhibiting your acid production. This little sphincter I was talking about is controlled by acid. So if you have heartburn and you take an antacid, you're making your stomach less acidic, more neutral, and that hole is going to keep opening. And so that acid, even though it's less acidic, it's still stomach acid. So it's still going to come up into your throat and you're going to feel the heartburn more. So it's almost like we're walking in a circle trying to treat heartburn with an antacid, because you're really just opening that sphincter more. What we need to do is increase the acid in your stomach by giving hydrochloric acid, which is what our stomach is, or zinc, which is the precursor. Eating digestive enzymes, bitters, those kind of things will increase the acid, help the digestion, and actually close that sphincter up. So after we do the adjustment, that acid reflux is not coming back up. So that's the structural side, that's the chemical side, and then like I said, the emotional side. And so if we're just looking at one or the other, we're only going to heal the body, a third of the way or 2/3 of the way. We really need to look at that whole pyramid, that whole circle of holistically what we're about. And if you've tuned into any of my more recent, or I guess past videos, then you'll kind of know, what that's about. If you haven't seen them, let me know. I can send you the link. And then because you guys showed up today, whether it was online or on Zoom, I am offering you guys a discount for either a first visit, a follow-up visit, supplements, depending on where you need it. So go ahead, shoot me an email, let Avery know in the back. She has some goodies for you as well. Yeah, let me know what questions you guys have. I'm going to host this every week. Next week, we're going to talk about the nervous system, the parasympathetic, sympathetic, how to support those, what they do, you know, why we need them, all of those kind of things. So yeah, let me know what kind of topics you guys you're interested in, looking for, and we will be in touch. Thank you guys all for tuning in. Thanks for listening. Just trying to spread that naturopathic word. There's so much stuff going on in our world right now, and I would like to be a light that, you know, shines the natural side. I know there's few and far between of us, but you know, the more of us that are speaking out, the more we're just getting this word out, and it takes a village. So share this video, invite your friends next time, and yeah, let me know what kind of information you guys are looking to hear. So yeah, good to see everybody. Let me know if you have any questions. But I'll stop the live recordings for now. So thanks everyone for coming.